Good evening, everyone. We may be close to an answer tonight to one of the most concerning questions among those who have suffered the ravages of COVID-19. If you've had the coronavirus and recovered, can you get it again or even give it to others? Tonight, research out of South Korea, one of the countries most successful in fighting the virus, indicates the answer to both questions is no. The findings also shedding light on the question of immunity. It's where we start tonight with NBC's.
It's the kind of good news development that researchers have been hoping for. Preliminary findings from the South Korean Centers for Disease Control suggest patients who recovered from COVID-19 but then tested positive for the virus again were not infectious and were not spreading the virus to others. 447 South Koreans tested positive a second time, but those virus traces appeared to be dead, not alive. Could it be an indication of immunity?
Let's take it to South Korea now, where President Moon Jae-in's governing party has won an unprecedented landslide in parliamentary elections, which were the first to be held amid the pandemic. The ruling Democratic Party had highlighted the country's so far successful fight against COVID-19, which has brought the number of daily infections down from a peak of 900 a day in late February to under 30 new cases a day. Millions turned out to cast their ballots. You can see them there, everyone wearing masks, using hand sanitizers and wearing plastic gloves. Our correspondent Laura Bickett says it's been an historic 24 hours.
We have seen a number of political records come tumbling down here. It has been the highest turnout since 1992. People thought the coronavirus would keep voters away. It didn't. 66% of voters turned out despite the restrictions, having to wear a mask, stand a metre apart, use hand sanitizer, plastic gloves. They all managed it and went through. Of course, we may have to wait another 2 weeks to see if all was kept safe.
Avec moins de 11 000 cas recensés, la Corée du Sud affiche un bilan bien moins important que les pays occidentaux. Plus fort de l'épidémie, le 29 février, le pays était l'un des principaux foyers du Covid-19 avec plus de 900 contaminations. 2 mois plus tard, les autorités sud-coréennes ont réussi à renverser la tendance.
오늘 발생한 4명의 환자는 모두 검역 단계에서 확진되었고 지역사회 감염 환자는 없었습니다. 또한 약 2,900만 명이 투표에 참여한 지난 총선으로 인한 확진자도 발생하지 않은 것으로 보입니다.
Il y a 2 semaines, la Corée du Sud était l'un des premiers pays au monde à tenir des élections.
A month ago, the Republic of Korea was faced with accelerating community transmission. But it didn't surrender. It educated, empowered, and engaged communities. It developed an innovative testing strategy and expanded lab capacity. It rationed the use of masks. It did exhaustive contact tracing and testing in selected areas. And it isolated suspected cases in these designated facilities rather than hospitals or at home. As a result, cases have been declining for weeks. At the peak, there were more than 800 cases, and yesterday, the report was only 90 cases. WHO is working in solidarity with other countries.
开始你能不能告诉我们，你觉得他这个做得好的这个应对主要取决于哪些方面？
我觉得韩国的这个疫情的发展呀，首先平缓，让急速上升，然后又有一个良好的下降，其实反映了这个韩国它应对的一些特点。其实应该说，韩国对这个疫情啊是高度重视的。从你刚才提到的第一例这个病例开始出现开始呢，那么韩国就马上启动了很多的一些工作，包括进行流调的这些调查，包括限制这个武汉地区的有武汉地区旅行史的人入境。当然这个后来也受到很多国内的批评啊，说你为什么不全面禁止？但实际上它是很早做出这个决定的。这样的一个国家，另外呢，就是说他还早在2月初就决定说学校要推迟开学，2月初就做出了这样的一个决定。后来他们包括韩国推广这种快速检测嘛，它的这个检测技术确实是应该说是得到了这个国际社会的高度认可。
这个我们可以来跟日本做一个对比啊，因为我们看到韩国这次发明了一种很好的一个检测，就像你买麦当劳这个汉堡包一样，它 drive through 你都不用停车哈，
就把车窗摇下来，
车窗
10分钟
，10分钟就可以检测，然后结果在
它是检测取样。然后结果在短信告诉你
在6个小时之内就可以，
甚至最快的2个小时就可以。
所以我看到它的这个检测的人数是非常众多，一天可以测到2万例啊，
完全可以。
对， 但在2万例的检测基础上，哈，其实我们看到这个人数还是在我们刚才提到还是在持续的这个下降。
那么韩国呢，是不是还有另外一个，就是它比较精准，它能够这个跟踪这个感染者，就所有的这个亲密接触者，它能够把这个重点放在这里。那么根据你的身份证、你的这个旅行这个记录，包括你这个健康卡的旅行记录，它有一套特殊的这个管理系统。根据这个呢，它就这样的话，它省去了很大的精力。
就它的国内的信息化做到
信息化做到，
这
个是其他
国家没有办法。它是这个手机啊、信用卡都可以追踪到你去过哪，你的密接者是谁等等。
这是它的一个重要特点。
日本是做不到这个。
日本做不到。